Good evening, friends. Today we are going to discuss about a very common topic, that is indigestion. Now, what is indigestion? Basically, anything that causes pain or discomfort in your stomach when you eat something due to either issues with the stomach, whether it is due to overeating, whether it is due to eating less or empty stomach, ingesting medicines in empty stomach, or even when in cases of males, excessive alcohol consumption, or there may be other issues that are associated like ulcers in the stomach. These all causes can cause indigestion or dyspepsia, which is commonly known as the medical term. Now, in this condition, what happens is that basically the patient has pain or a heaviness in the chest. They may have pain in the stomach after eating food, which may be immediately, even if they eat the slightest food, or even if they are if they in the process of digestion in 1 or 2 hours, they may have discomfort or bloating in the stomach. There may be flatulence, or there may be difficulty or in breathing in some cases. So there are many symptoms that can be caused or as the causative factors for these. Now there are many homeopathic medicines that are available for this. अब हम इसमें बात करते हैं कुछ खास होम्योपैथिक मेडिसिन्स की, जिसमें से फर्स्ट एंड फोरमोस्ट विच आर वेरी इंपॉर्टेंट इज़ नक्सवामिका. नक्सवामिका उन केसेस में इम्पॉर्टेंट है जहाँ पे पेशेंट एक्सेसिव अल्कोहल कंजम्पशन करते हैं, वेयर देयर इज़ मोर ईटिंग ऑफ स्पाइसी एंड हैवी फूड, especially there is much bloating. They have tenesmus or cramps in the abdomen sometimes, and if they pass the stool and go to the washroom, after that they feel better. Then there are some cases, then we have another medicine that is called Pulsatilla. Pulsatilla उन केसेस में इफ़ेक्टिव रहती है जहाँ पे पेशेंट हैवी फूड लेता है, फैटी फूड खाता है, स्पेशली स्वीट्स, आइसक्रीम्स और पेस्ट्रीज, बटर. So those cases में अगर after eating those the patient feels bloated or heavy, then this medicine can help them. Another medicine that can be given after this is Carboveg. This also has more cases where there is more eructations, patient को डकार बहुत आते हैं, heaviness और bloating होता है abdomen में, gas बहुत form होता है. So in those cases Carboveg can be given, and it is really helpful in those cases. Other medicines that can be given are China, Lycopodium. These also have similar symptoms with differentiations which can be prescribed according to the symptoms. अब हम बात करते हैं सेकेंड कॉज जो इंडाइजेशन कॉज कर सकता है, इस केसेस वेयर देयर इज़ द लिवर इज़ इन्वॉल्व्ड. नाउ इन सम patients there is problem with the liver. Now the liver may be fatty, the liver may not be functioning properly, or there may be cirrhosis of the liver as in case of alcoholics. So in those cases the main cause, that factor that can cause this indigestion, is the improper production of bile. Now this could also be due to gallstone colics, or there may be other factors involved where the liver is in defect. In cases के अंदर we can think of medicines that are Lycopodium. We can think of where there is gallstone colics and due to that there is indigestion. Lycopodium can be really helpful for the gallstones as well as for the indigestion. Then we can think of another medicine, that is Chelidonium, Geonanthus. Then there are some other medicines that are very important and can be really helpful in this case. Now other forms of factors that can cause indigestion would be involvement of the stomach. Now if there is some problem in the stomach, such as gastric ulcers, duodenal ulcers, there could be regurgitation or acid reflux as commonly known as. So in all those cases, this case may be due to that, and then the medicines that are given are according to the symptoms of the patient. In these cases mostly there is burning in the chest, in the esophagus, sometimes in case of gastroesophageal reflux तो पेशेंट अगर खाता है तो उसको हैवीनेस रहता है, बर्निंग रहता है आपके ईसोफेगस में, और आपको बर्निंग के साथ खट्टे डकार आना, हैवीनेस, हेडेक होना, कईयों को वॉमिटिंग एंड नोज़िया भी हो जाता है. So in those cases, according to the symptoms, there are medicines that can be prescribed. Then there is other medicines that can be given if we go further down, like in cases of causes due to the intestinal problems. Now intestinal problems ke andar we can think of like small and large intestine. So in cases of the small intestine, again where there is ileocecal जंक्शन, वहाँ पे कोई इशू रहता है, ब्लॉकेज हो जाता है, इंटरसेप्शन हो जाता है, या कई बार इंटेस्टाइन का प्रॉपर मूवमेंट नहीं हो रहा है. In those cases, as well as in the large intestine, where there is constipation के करके there is blockage of the large intestine, or the intestines have become really sluggish due to various reasons of many years, in some cases not taking the proper food, or there is low fiber or roughage in your diet, or there is not enough water intake. So in all those cases there can be bloating, flatulence, gas formation, and all these causes can lead to indigestion. So these are some of the common causes that can cause indigestion or dyspepsia. There is, however, some things or some points that we can follow or take as precaution to prevent this, along with the medicines. Now what we can do is like take more water intake. Like in most cases it's important to take at least 8 to 10 glasses of water. रोज़ आप 8 से 10 ग्लास वाटर ले रहे हैं अगर on an average in an adult person, then that can actually help in the proper mobilization of the fluid and the food in the stomach and the intestine. नेक्स्ट जो कॉज हम सोच सकते हैं, नेक्स्ट थिंग इज़ adding more fiber in your diet. Now the fiber should be important. It's important to know the difference that fiber, those cases जहाँ पे flatulence और gas formation ज़्यादा है, it's not advisable to give more fiber as such from fiber causing foods such as peas हो गया, beans हो गए, या other राजमा, चावल, और वो सब चीज़ों को avoid करना ज़रूरी है. But what you can do is basically improve more roughage in your diet. So roughage can be in form of green vegetables, spinach. You can include fruits such as apples, oranges, bananas, which is highly good in fiber as well as potassium and magnesium. Then there are other fibers and fruits that you can add in your diet. जो भी आपके local foods available हैं, like papaya, chicus, bananas, apples. So whichever seasonal fruits are available, if you inculcate at least 2 of them in your diet, that would be really helpful. Then comes next thing that you can do to prevent the indigestion is that to avoid eating just before sleeping. So it's important that when you are eating, you keep a gap of at least 2 hours. So from having your dinner, if you are having it at 8, it's important to take it around 10, that you don't eat anything if you are sleeping at 10 or 11. However, it's more advisable कि आप 7 बजे तक अपना डिनर कर लें, so your stomach has the time to digest that food. So there, because as the night comes, आपकी digestion वैसे ही slow हो जाती है. So it's important that you increase the digestion process or digestive process, or helps the body to actually naturally increase your intestinal digestion in a natural way. Next, what other things you can do is avoid the things that can cause or that are the triggering factors in your diet, such as in people जो ज़्यादा alcohol लेते हैं, ज़्यादा spicy food खाते हैं, especially during the evening or immediately empty stomach, they take pills, antacids ले लेते हैं, high doses of antacids, especially in empty stomach. So all those things should be avoided because those can affect the mucous lining of your stomach, and that could actually cause the problem or aggravate your symptoms of indigestion. So I hope this video was informative with you. Thank you and have a good day.